we set these resolutions, we put these expectations on ourselves, and then we can't meet them. And then we go into burnout and depression. I'm going to be more active. I'm going to do more exercise. I'm going to go to the gym more. January 1st, the gym is full of people, right? Everyone's so excited. But what happens as January goes by, January 15th, January 20th, February 1st, we're so burnt out because we were so motivated to do all of this. We used all of our energy and now we can't do it anymore. We basically then give up. Then we're hard on ourselves that we're not capable of doing this. Hello, and welcome to the season finale of season 2 of the How Are You Really podcast. I am being festive. I've got my Mickey Santa Christmas thing going over here because we all know I love Disney World, a huge Disney fan. And then I've got my sparkly top for New Year's. I am super excited about this episode because I really want to talk about a few important things that come at the end of the year with the winter season. Australia, please take the seasonal stuff for when it is winter there. Actually, all of Southern Hemisphere. But for the Northern Hemisphere, we're going to talk about winter and we're going to talk about New Year's and end of the year and start of the new year. I am your host, Dr. Faryal Malik. I am a child, adolescent, and adult psychiatrist, and I love doing this podcast, communicating with you guys and raising awareness. I do want to say that this season was a little bit slower. We had a few fewer episodes. Something like that. You know what I'm saying. And we made it to the end of the year. And I really wanted to do this episode before 2026 starts and end the season here so we can start afresh with season 3 next month. So what I want to focus on is seasonal affective disorder, which is basically seasonal depression, and talk about why this happens, why it happens in Florida and even Texas or the southern states that are warmer, and why you're not feeling that great right now. So yes, holiday season is hard. A lot of us have had losses around this season. It is stressful. I'm not going to lie. I fell for it this year. Lots of Black Friday shopping, lots of shopping since, Thanksgiving. I totally fell for it this year. I didn't need a new wardrobe, but that's not all I shopped for. Shopped way too much. But we're looking to buy gifts. There's Hanukkah, there's Christmas, all of the holidays. There's so many holiday parties. And I did post an episode before Thanksgiving about the holiday parties and all the holiday stress that comes around this time, end of year. And we're through most of the holiday parties at this point. Today is the 22nd, and I think I'm going to post this tomorrow on the 23rd. So we just have Christmas, and then we're going to move into New Year's. So most of the holiday parties have already happened. However, I hope you guys took care of yourselves, set some boundaries, didn't want to show up for everything, made it so that you haven't burnt yourself out even before Christmas is here. Most of us are celebrating Christmas. Hanukkah was last night, last night. So I am going to start with saying that all this stress obviously adds to our mood being lower. We're missing family members. We are grieving our losses at the same time. We're stressing out about financially, about buying gifts and traveling during the season. Your flights are getting delayed and you're stuck at the airport. Like, there's so much about this season that's like hustle, bustle, go, 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 So our moods do get affected by all of that. However, right around November, I used to have this too. All of a sudden, my heart just felt like something just dropped. And I would start having like a really hard time putting one foot in front of the other, just really feeling low energy. And it was very difficult to, get out and do things or even go to work. Like, that was a struggle. So I know that a lot of people start asking for more therapy appointments, start getting more depressed right around November. It's not just the holidays, right? It's not just the end of the year. It also can be seasonal affective, disorder. When I moved to Florida initially, the first time around, I thought that I wouldn't have seasonal affective. And I thought that that was just a thing of the North, and it gets gray and it gets brown. There's no greenery there, and it's way too cold and just gray all the time. Like, I used to think that that's what was causing me to feel that way in November. However, this happened here in Florida as well. I had gotten off my medication thinking that I was going to be just fine. However, November hit, and yes, I still had the big drop in mood, the big drop in energy, just this weird emptiness, which, whomever has depression has probably experienced that empty, hollow feeling that's beyond just sadness, which sadness is an emotion, and we all want to experience all kinds of emotions. And so that's not the problem. But when we have this emptiness and just a weird hollow and just the space, and it's hard to explain if you haven't experienced this, but if you have, you know what I'm talking about. So in November, a lot of my patients will ask for more appointments. Great. I do want you guys to do that. In December, even though I've taken some days off, I told all my people that please, please, please feel free to text me, email, or portal messages might be hard for me to respond to. However, if you send text, I will intermittently look at my phone and respond, because this is a hard time. People are more depressed. So I do appreciate whoever recognizes that this is a harder time and they need a little bit more help. Seek it, go for it. I had to last week reschedule, or on the verge of canceling my therapy appointment. And I asked my therapist to just do a phone appointment with me the evening before when I usually have therapy. And thankfully he agreed, and I was able to get in a therapy session. It's okay to be asking for help, asking for extra help, asking for support. Yes, please do that, right? Not only that, but also sometimes for some people, I do have to increase their dose starting in November of their antidepressant. And then we make it a note that in March, April, we're going to come back to their regular dose. So sometimes you do need a little bit higher dose of medication as well during this season. It's not just the holidays. Okay, so what happens, right? It's like, obviously in the North, it's the cold weather. You can't get out as easily. You don't want to get out of bed. It gets dark sooner. So all these factors are playing a role in the seasonal stuff. But then also, why does it happen in Florida? Yes, it is getting dark sooner here as well, but the weather actually is nicer, right? Like, we're out of the 90s and we're in the 70s, and it gets a little cool in the evening and it's a little cool in the morning, so we can wear our jackets and our boots and be our little fashionable selves and not just completely miss out on wearing sweaters and boots and jackets and, cute stuff, and still be comfortable. But we still will experience some sort of something. So what happens is that the cold air that is passing through the north creates an air pressure change down south too. Specifically, I'm talking about Florida, right? And the air pressure changes cause a change in mood. Back when I was doing residency, one of my attendings, I'm so thankful for him. He has taught me so much. He talked about how nurses and a lot of people think it's a full moon, and then in the psyche art, you see more people come in because it's a full moon. They actually ended up doing a little research project on this to see if that is actually true, and ended up finding out they did a lot of different factors and found out that it wasn't so much the moon, it was the air pressure changes that were causing people to come in more versus less. And so that has been researched. Looking at that research, applying it to weather and seasons, that air pressure change, because all that cold air is cold fronts that come through up in north, they affect the south too. And even if it's like 80 degrees here, which I think it's going to be 80 high today, it's probably 80 high right now outdoors. But even then, that air pressure causes us to have mood changes. So there you go. That's seasonal depression, and it's going to happen in anywhere you are. If you have depression, your depression might get worse. Your moods might get worse. If you don't have depression, you might still have seasonal affective disorder. That's one of the things, right? Of course, we still in Florida. Sunset is what, 5:30 or something. So it's going to get dark sooner, and it is going to be cool during the evenings. And some people have moved to Florida because they don't want the cold weather. All of this does play a role in it. So asking for help is okay. Increasing your therapy sessions is okay. Increasing your medication dose temporarily is okay. All of this is just fine. Okay. Combining that with all the holiday pressure, please, please, please remember to set boundaries. Remember to take time for yourself, take pauses. We actually last week did a little event at the clinic/spa where we did a rest between the rush, and we did a little cacao ceremony. Kudos to Christine. She's going to be on season 3, I promise. Come and talk about sound healing. So we did sound bath, and it was a great pause to take as all the holiday parties were going on. And we have another pause coming up this weekend, which is our post holiday mini vacation. That's just a break from all of the holiday chaos now. Christmas is done. We've done all the parties. We've had all the food. Hanukkah is done. And so now we're going to take a pause for yourself. You've done all the family thing. You've done all the friends thing. This is now your time. So we're going to talk. We're going to do some intentions. We're going to do some self-care with the sauna and the massage chairs, and then we're going to do the sound bath. And after the sound bath, we're going to do reflections. And so that's a pause, right? You're not in Tampa. That's totally fine. Do this for yourself. You could create a few hours, 3 hours on Saturday, which are just yours, and take a pause for you. Tell your family you need a little pause, plan it out, put some YouTube on, do some yoga, do some sound healing. You can look for videos and stuff. Or in your area, there might be sound healers that you can do a sound bath with. Just, make sure that you're creating a little time for yourself, 2-3 hours, just that, taking a pause, right? Giving yourself some love, some self-care, some just pause where you are not thinking about anything. This will prepare you for the new year, right? Because New Year's Eve is a thing. As we get older, it becomes less of a thing. We're not doing too much. We're maybe doing a party with our friends, or we are just sitting calmly at home, which is also great. But we're always thinking about, somehow psychologically, the year end brings these things up. It has been bringing these things up for me, where I'm thinking about all the stuff that happened in 2025 and all the things that got accomplished, all the sad things that happened. Everything is just like recapping. I've talked to some of my patients. I've told them how hard they've worked this year and all the stuff, all the work that they put in. There's all of that, of course. It's like a psychological thing. We're all thinking about end of the year. So that's happening. And we're like concluding all the things that got accomplished. And that's fine. You can think about that. However, the calendar year is a human created thing, right? If you look at it from another point of view, the lunar calendar is actually the real calendar, I guess, because you're following the moon, right? So, there's a lot of psychological, cultural stuff that goes into New Year's Eve and New Year's and the resolutions. My opinion about resolutions. I used to be that person that would set New Year's resolutions and think about what, my goals are going to be for 2026 or the new year, right? I remember one year it was like a family gathering, and there was a person in an extended family that actually made remarks that I did not appreciate. And this was New Year's Eve when we were going around, everyone's talking about their resolutions and just like doing a little, reflection kind of thing and an intention setting thing. And I talked about how I wanted to lose weight. And the remark that was made was just not very kind. And I recognized that year, and it was a very rare thing for me to be setting New Year's resolutions. I think I gave up on the resolutions years ago. I feel like we set these resolutions, we put these expectations on ourselves, and then we can't meet them. And then we go again into burnout and depression and a disappointment in ourselves. So thinking about that, right? So that year, because we were doing this fun little exercise with family, the gathering that we had, I did bring that up. And so it was like really put down on me that that's not going to happen or something like that, right? And so I feel like when we set resolutions, we put so much pressure on ourselves. It's kind of like the weight loss thing, right? It's everyone's. I'm going to be more active. I'm going to do more exercise. I'm going to go to the gym more. Da, 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 da. January 1st, the gym is full of people, right? And then what happens? We see a whole bunch of people sign up, and you go to the gym and there's no treadmill that's available, and you're waiting on people to get done. And a lot of these people, actually, for me, it was like Stretch Lab one year. I used to go to Stretch Lab very regularly to get assisted stretching, which I'm a huge proponent of. You know, I think that it's great. The facilitated assisted stretching is just amazing for your body, better than massages. So I used to go there, and like in January, I couldn't find an appointment time that would work for me because all the appointment times were taken already. So there was like barely any availability. Forget about availability according to my schedule. That was just so what happened was all those gift cards that were given over Christmas and all the motivation that people get, it was all just completely booked out. And that's exactly what happens to gyms and other fitness places. And they're just all booked out because it's the self-care and like everything. Everyone's so excited. But what happens as January goes by, January 15th, January 20th, February 1st, we're so burnt out because we were so motivated to do all of this that now we used all of our energy and now we can't do it anymore. We can't keep up because of work, family, lifestyle, whatever it is, right? Overall, we cannot do it. So we burn out and we basically then give up. Then we're hard on ourselves that we're not capable of doing this. Even if we don't clearly say it, unconsciously, we're kind of telling our being mean to ourselves, and having poor self-care and self-kindness and generosity, right? Because charity starts at home, which means charity starts individually. You have to be kind to yourself and generous to yourself. And we don't do that. We forget to do it. So I am a huge proponent of if something is coming to your mind that you want to make a change next year. We're talking about 2026. Time has flown. This year went by. For most people, really quickly. For some people, slow, but for most people, really quickly. If you're thinking about a resolution or you're thinking about an intention that you're setting, start today. Do not wait for January 1st. Because if you start today, you're going to start a little. Holidays are going still. You're not going to overwhelm yourself. You're going to do a little bit of it, right? For instance, one of my things was that I'm going to have more date nights and talk less about work with my husband. So I started date nights 2 weeks ago. I started incorporating them. I replaced a holiday party or two with date night. Not two. I went to one of them and then just had dinner with my husband after because that was just like a mingling kind of um event and not really a dinner. Yeah, do those things sooner rather than later. And that's one thing. The other thing is we want to have smaller goals for lesser time instead of having all our goals all together for 2020. We want to set smaller goals. So maybe a weekly goal, right? Or maybe a monthly goal. I think monthly is more realistic than weekly because that's still a lot of goals, right? But if you just like have a monthly goal and then break it down to weekly, right? That this week I'm going to do this much of this, right? I did this little exercise at that event last week where we had like these mini Yule jars. Christine had us do intentions for 2026. Like she had us write like 12 of them and put them in the little Yule jar and pull out one each day and burn it until January 1st. The one you pull out on January 1st is the one you're going to try and focus on, which was incredible. I really liked the exercise. Yesterday, I pulled out Forgive Freely and I ended up burning it. But what happened with me looking at it last night was like, yes, maybe this is not something that I'm going to focus on January 1st, but I'm going to have an intention in my mind that I am going to practice forgiveness more. Forgiveness for myself, forgiveness for others, for family members, for friends, for coworkers, and generally, right? We get angry at things really easily. So learning to forgive more. And so it's on my mind, right? It's not on my mind that I'm going to do this and this is going to be my focus and that's all I'm going to do. It's just a general little thought that is kind of there, right? So doing little exercises like that, I know that some people do just create bigger jars and do that yearly or weekly or something and put things, write things, kind things on it for yourself to pull out. And you can buy these pre-made jars and they can be religious, non-religious, or intentional. And I think that that is also a really good little exercise to do where we're just pulling something out on a daily or weekly basis. Same thing with goals. Remember ADHD stuff, season finale of season 1, where we talked about the little to-do list and all of that. So maybe having a little thing where you have your monthly goals, right? The exercise we did last night was kind of cool, or last week that we started, and I started opening up the things yesterday. It was 12 things, right? So those 12 things can actually get a calendar and put the thing on each month and make realistic goals. One of my goals is to drink more water. And I tell people all the time, you need to drink more water. You need to drink more water, which I need to drink more water today. But one of my things was drink 40 ounces of water. We should be drinking 64 ounces technically, right? But I put down 40 intentionally thinking that what is realistic for me, right? What is a realistic amount of water that I can drink while I'm doing clinic or while I'm doing seeing patients or doing my work, and not having to run to the restroom every 30 minutes, which I don't know. It's old age, I guess. I run to the bathroom frequently now. But what is a realistic amount of water that I can drink? And I'm going to set that goal. I was thinking initially that 3 8-ounce glasses, maybe that's where I can start. But then I challenged myself to increase that amount and went to 40 ounces instead. So challenge yourself a little bit, but don't overwhelm yourself with your goals. Make them realistic. What can be done? And so that's my opinion on New Year's resolutions. We all just focus way too much on New Year's stuff and just 2026 is coming. I'm going to be this. This is going to be my year. Da, da, da. And so one of the kids that I see for therapy was saying this that I want it to be my year. I don't like when people say that. It's so cliche, but I really want 2026 to be my year. And what I told the kiddo was, hey, let's talk about this, right? You might have a good day and a bad day. You might have a good week and a bad week. That doesn't make it any less of your year. We go with a realistic expectation into the next new year, thinking that, yes, we're going to have good days and we're going to have bad days and we're going to have good weeks and bad weeks. And we're going to accept it as it comes. We're going to be mindful. We're going to be just open-heartedly accept the good with the bad and still make it our year. Every year is our year. Small goals, small things. I had set some things that I want to do in 2026, not because it's 2026, but I'm signed up for lifestyle medicine boards, and I do want to do obesity medicine as well. So there's a lot of learning that I want to do this year because the boards are, scheduled for this year. Not because oh, it's absolutely 2026, but I couldn't do the boards this year in 2025. It was a little too much for me. So I moved one of them to 2026. The one was already there. So I'm being very mindful of that. Can I actually realistically do both in 2026? Or do I need to move one of them to 2027? And if I do, it is okay, right? It is okay. Even though I wanted to do this and I've delayed something from 2025 to 2026 because I just didn't have enough time, I felt it's okay. I don't want to overwhelm myself in 2026 either, right? So if I decide as the year moves along that this is too much for me, It's okay for me to move it to 2027 or one of them to 2027. So keeping that in mind, right? Having the flexibility in your mind to move things around is also important. So, um, yeah, this is my thing about New Year's resolutions and my advice on it and my take on it, that don't focus so much on a goal and just overwhelm yourself and then overwork yourself and burn yourself out trying to achieve it and then feel bad that you didn't achieve it. I'm repeating myself a little, so I'm going to move on. The thing is that coming back to the first thing I talked about, seasonal affective, right? So this is a thing that starts in November, and I think March, April is when it starts lifting, sometimes in February for some people, but mostly March, April, right? So how about we make goals that we start working on in March, right? Spring goals. Let's make some spring cleaning goal. Just think about, okay, I know that January is starting and everyone's going to be working on their resolutions and their goals, but how about I plan for something that I'm going to start doing in March once the season changes and spring comes around and the weather lifts and the air pressure changes come about, and we're just going to be entering this beautiful weather and having like a almost like a new beginning, right? March is supposed to be the new beginning, March, April. And so think about that, right? Rather than having all this pressure on you for January, right? Focus on what I'm going to accomplish in March, or what am I going to start doing in March, right? I'm going to come back to all these thoughts that I'm having and all these goals that I have for 2026. I'm going to come back to them in March, right? I'm not going to worry about everything in January. I'm going to have like a teeny tiny goal. Okay, I'm going to try to drink more water and be mindful of that. That's it. That's all you want to focus on, right? And even then, you're not going to be able to do that overnight. Like, you're going to start out drinking all the water that you made a goal of. Like, I'm talking about myself clearly. And I'm going to like burn myself out after like a week. I won't be following it. So my goal is going to be that I drink, maybe if I drink one large cup, right? If I drink 12 ounces, I'm going to increase it to 15 on January 1st, right? 12 ounces is very little and kind of sad. But yeah, I'm just going to increase it a little bit, right? So little by little, I'm going to do little, very tiny goals to get to that big goal. So yeah, I think that mindset shift, knowing that even if you don't have seasonal affective, this is a hard time of the year for everyone. And start of the year puts so much pressure on everyone now, where we have to do our taxes and blah, 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 blah. Like, there's so much at the beginning of the year brings that, like, it's important to take a pause and not put pressure on ourselves for the goals that we want to have for the next year. Not everything needs to be accomplished in 2026. I remember that at some point, this was, I think, 2022, I had graduated from all of my fellowships and everything that year, because we're looking at academic year now, July to July. And that's how, in the medical world things run. So that year, I was like, every year I've had this thing of, I'm going to graduate this and then I'm going to move on to this, right, for the next year. I don't know what to do now for 2023. I don't know what to think about, what goal to make. Like, it feels really weird because I'm so much embedded into education, and this has been every year like a goal thing. And one of my mentors, he was actually one of my supervisors when I was doing research. He came on there and commented on my status and said, "You know what? It's the little things. My thing is that I'm going to write this research paper this year. So make these little goals. You don't have to have big goals." I didn't have any um idea that I'm going to have to redo my kitchen. I don't know if you guys have heard about my kitchen. Oh my gosh, my kitchen. But January came along and I was like, I'm going to wait. I'm going to wait. I was very sick. It wasn't COVID. It wasn't the flu. I was just really sick. And so was my husband. We're both really sick. And our fridge stops working. I think that was one of the big appliances. My whole thing was that this fridge is going to break down and then I'm going to renovate my kitchen. The fridge broke down at the worst time possible, because everything, when it rains, it pours. We're sick. and the fridge broke. Now we don't have anything to eat, and I'm thankful for this person that I had only known online. I've still not, like, officially sat down and had a meal with her, but last January, she dropped off food at my door for me and my husband because we were sick. That was just so kind of her, and I'm so thankful for her. So that's when I decided that, okay, well, kitchen's gonna need to be done now because everything's died, and I really, really do not want to replace this fridge without redoing the kitchen. So we got a teeny tiny fridge. Not that tiny, but like, the small fridge was whatever number of dollars. Now it sits in our garage. It's our drink fridge now. So all our Gatorade and, stuff like that goes in that fridge. Yeah, so I didn't make a goal that was gonna be something that is gonna happen in 2025, but it automatically became a thing, right? So leave space for that. So you don't create like so many resolutions that if something comes up, now that's another thing that you have to put on your goal list for that year. Everything works out at the end of the day. Putting pressure on ourselves, we burn ourselves out. So don't do that. Please don't do that, especially during this time of year when, the weather is kind of gloomy. Not here in Florida. It's really sunny outside right now. Beautiful day today. But, it still is going to be dark in a few hours. It's like 2:40 p.m. and like lo and behold, it's going to be 3 hours and it's going to start getting dark. So, the days are really short, right? Last night was winter solstice, so days are going to start getting longer. However, wait until March, slow yourself down. Do not make a million resolutions. Do not burn yourself out. That's my message for 2025 for this season finale. I really want everyone to just slow down because we're so go, go, go. That's why 2025 went by so quickly because we're always on the go. So slowing down and taking everything a day at a time is kindness to yourself. And so I think that would be great for all of us. I want to reflect a little bit on our season 2 episodes. This is the 10th episode, so we were able to, between August and December, put out 9 episodes, which is, I think, a huge win. I think that I was trying to do this weekly, and it was too much for me to do it weekly, and so I really slowed it down. There was a gap of 4 weeks at some point, and there was a gap of 2 weeks, or 3 weeks and whatever. Like, it's okay. And just now when I was about to sit down to record this episode, my husband was like, "Are you sure you want to post this tomorrow? You can always post it next week." And I was like, "Well, it's not going to be a very long episode, so I think I'll manage, right? But if I'm not able to edit it today, that's okay, right? I don't have to post it tomorrow. I can post it Wednesday morning. I can post it next Tuesday. It's okay, right?" So I wanted to reflect on that. Our first episode of the season was Listen Physicians, and just knowing how important it is for us to pay attention and listen just in general. Forget about being a psychiatrist, right? Just in general, listen to others. Slow down and listen to others. Put your phone down, right? Be present. And as far as the Listen Physicians is concerned, as psychiatrists, we want to rebrand ourselves. Please, please, please. My biggest message for 2025, if anything, is that psychiatrists do therapy. We do provide therapy. We are trained in therapy. Freud was a physician. So just keeping this in mind, I know that the concept is that psychologists or therapists are the one that provide therapy, but no, you're a psychiatrist, just provide therapy. We do listen. We do take our time. And I think that not only that we want other psychiatrists to slow down and think about this, but also I would love to give this message to everyone that as psychiatrists, we do provide therapy, right? A lot of us have taken the time to do extra training in it as well. So that was our starting point, but then we had some amazing episodes. So we did the mind body connection, such an important topic. I'm a huge proponent of mind body, right? Yes, when you're working out, slow down. Think about what you're feeling in your body. Don't just go, go, go and hurt yourself, right? Feel your body. Learn how to connect your body with your mind. And so the mind-body connection is so important. Doing something with our hands, creating something, and putting movement into our body and being mindful about that movement creates this connection back between our mind and body that has been missing. We also did some body image and stigma stuff. So again, do not make crazy diet and New Year's resolutions on fitness and all of that. Take it easy, take it slow, one day at a time, a little bit at a time. No big goals, no focusing so much on your weight that you're putting yourself in depression. I actually will say this, I had gained a lot of weight and I had been struggling with it and I did lose weight. But if I look at my weight in numbers, I am not at the weight where ideally I would like to be. However, when I am going and buying clothes in tops, I've started fitting into a medium. And it is impossible for my brain to imagine how the number on the scale is not matching with the size of clothes I'm wearing. I was a lot less in weight when I was fitting into a medium. So stop focusing on the scale, stop focusing on the numbers, right? See how your body feels. Again, mind-body connection and body image and stigma and weight stigma, all of that, like just combine it all together, right? Don't focus so much on the scale. See how you feel in your body. That is the most important thing. If you're hurting somewhere, slow down, right? Do the appropriate exercises, do protective things to make yourself stronger. Do not focus on the numbers or your appearance. Focus on the pain. The reason why I lost weight was because my knees, oh my God, my knees. Right around this time last year, my cousin got married and I had danced a lot. I love dancing. I think you guys know that I love dancing. Had hurt my knees so bad because of my weight that all of January and February, I was wearing knee braces and I was just like, I don't know what all I was needing to do to deal with my knees. I was in a lot of pain. And that's what prompted me to be like, okay, I need to lose weight. I need to take the weight off of my ankles and my knees because I'm in pain, because I will have health issues. My hemoglobin A1C is going to be high. It was borderline high, which has come down. So those were like the things that I realized. And I really did not do this until February, where I was like, okay, well, something's not working. This is not a New Year's resolution. This is a, oh my God, I'm in pain resolution. So, just feel your body, right? No one should care. And people are so, internally occupied that we are human beings and we're so occupied with our own selves that nobody else actually sees or thinks or judges you the way you're judging yourself. So let go of that judgment. And also when you're judging yourself, it's easier to hear other people that are judging you, right? Rather than see all the positive messages that you're getting, you'll see the negative messages. So just also remember that the scale doesn't mean much. Okay. Then we had Cultural Crossroads, which was an episode about acculturation and the stress that comes with. And then we talked about ADHD a lot, actually, this time, didn't we? We did talk about like culture and ADHD and how the stigma around it is in certain cultures, and especially South Asian culture. We had an amazing guest speaker for that and had an incredible episode on ADHD. We did do another ADHD episode where we were talking about how parents can navigate the maze, right? You're trying to get your kid diagnosed because your gut feeling is that they have ADHD. Where do you start? How do you go about it? How do you get the services? How does all of this work? It's a great episode to watch. Like one of my friends came on and she had all these questions and she asked me all these questions. It was great. It was a great episode. I am really happy I did this and hopefully it helps other people be able to have a checklist of what you need to do. Then we had an episode about telehealth, a little episode where we talked about the nuances of telehealth and the benefits of telehealth and who telepsychiatry is for and who it's not for. It was a great episode. It was fun. It was funny. And I have quite a few amazing episodes planned for next season, a few that I have already a recording of and a few that are in the making. We are going to aim for bi-weekly posting. However, again, I'm going to say that I am going to listen to my mind and my body. And if I feel like it's too overwhelming, I might slow it down in between. So the goal isn't going to be churn out all these episodes. No, I think the quality was still great when I was churning out weekly, but I was burning myself out, and we don't want that. So I want to convey the message. I want to practice what I preach. I'm not going to burn myself out. This is going to be a slow and easy, calm season. And hopefully this episode helps you guys slow down and just look at where you're just kind of going and slow it down, right? Like today, I slowed down things. I was going to go get my nails done, and I was going to do this and that. And I was just like, you know what? I don't want to run around because I have a dance class that's at a fixed time that I have to be there. And I did not want to rush through my day to get everything accomplished so I could make the dance class in time. So I canceled everything, and I will do it tomorrow. I'll do it the day after tomorrow. It's okay. It is okay to slow down, you guys. Make your schedules okay and easy and slow down. I took off time where I am not going to be responding to every single email that I get. I am not going to be rushing to respond to emails, right? If I check it and I have a minute to reply, I will. Otherwise, I'm giving my mind a break. Please take that break for yourselves as well. Slow down, take a pause, take care of yourselves. Do not overwhelm yourself. Do not make New Year's a big deal, right? Enjoy your New Year's Eve. Celebrate, have fun, wear your sparkly clothes, and have a wonderful, wonderful New Year. Happy 2026. I will see you guys on the other side with our first episode. I'm going to say possibly the first Tuesday of January, just depending on if I can get to the editing or not. If I don't, then it'll be the second week of January, and that's okay, right? We are going to practice self-care, slowing down, pausing as much as we can, starting today, not January 1st. We're starting today. And just take care of yourselves. Have a happy end of the year. And I will see you guys in a few weeks. Also, at the end, of course, how am I forgetting this? How are you really doing? Ask yourself that, because I ask myself too. How am I really doing? Right now, I'm taking a deep breath because I want to make sure that everyone knows that pausing and taking a break is okay. When we don't take breaks, we forget doing things, right? We overlook things. We are disconnected with not only our bodies, ourselves, but also our loved ones, right? So I am doing good. My plan is to today take a pause after this, eat something, get some protein in, get some water in before my dance class this evening, and then come home, just relax, have a little time with my husband without any electronics. So just slow down and pause. And I hope that you guys will give that to yourself. So how am I really? I'm very excited. And at the same time, I'm being mindful of slowing down. Please ask yourself, how are you really doing? And what do you need? And whatever you need, please ask for it. Reach out for help. Thankful for all of you for joining me, for listening to this podcast, for supporting me. Please, please, please share this with anyone you think needs to slow down and take a pause, and hopefully enter 2026 more calmly, more generously to yourself, and more mindfully. Take care. Bye.